Thanks, Alan, and thank you, Renee, wherever you are, for arranging this. And it's an honor to be here representing the California Nurses Association, and we're standing in opposition of these cuts. It's sad that we're out here again to deal with, this trickle of reduction in staff and this reduction in care for the sickest people in Humboldt County. That's a theme I go back to because when you think about it, we have Mad River and we have Redwood, but where do the sickest patients go? They come here to St. Joe's. So they should be getting the best resources and the most resources. And instead, what we're seeing is that the hospital is making these calculations that maybe those patients on the progressive care unit don't need as many staff members caring for them. Maybe we can delay x-rays a little bit so that we can squeeze a little bit more money out of the community. And I think this is a calculus that is very unfortunate, and I don't think it's something that's consistent with principles of a nonprofit organization. I don't think it's consistent with the principles of a Catholic organization. I do think it's consistent with the principles of a corporation, and that's what unfortunately we're dealing with is a corporation. There's a great way to look at communication. There should be a closed loop of communication. So when somebody brings an issue, up, like a restraint issue, for instance, you should get feedback and you should know where that concern went. Especially when it's from a healthcare professional. We're not sitting here operating a candy store. No offense to anybody who is related to somebody who works at a candy store, but this is life and death, so it can't be taken lightly. So administration should be checking in with the bedside caregivers on a regular basis to find out the effects of the changes and the cuts that they're making. But they don't do that. They ignore us. Unfortunately, they ignore us. They say that all we're doing is expressing union rhetoric rather than really what's happening here, which is a bunch of concerned citizens, community members, healthcare professionals are standing up and saying the cuts you're making are wrong. You're cutting in the wrong place.